Mental health is the level of psychological well-being or an absence of mental disease. It is the state of somebody who is functioning at a satisfactory level of emotional and behavioral adjustment. From the perspectives of positive psychology or of holism, psychological state may include a person's ability to enjoy life and to make a balance between life activities and efforts to realize psychological resilience. According to the Planet Health Organization (WHO), psychological state includes subjective well-being, perceived self-efficacy, autonomy, competence, intergenerational dependence, and self-actualization of one's intellectual and emotional potential, among others. The WHO further states that the well-being of a private is encompassed within the realization of their abilities, dealing with normal stresses of life, productive work, and contribution to their community. Cultural differences, subjective assessments, and competing professional theories all affect how one defines mental health. Prevention. Mental health is conventionally defined as a hybrid of absence of a mental disturbance and presence of well-being. Focus is increasing on preventing mental disorders. Prevention is starting to appear in psychological state strategies, including the 2004 WHO report, Prevention of Mental Disorders, the 2008 EU Pact for Mental Health, and therefore the 2011 U.S. National Prevention Strategy. Some commentators have argued that a pragmatic and practical approach to mental disorder prevention at work would be to treat it the same way as physical injury prevention. Prevention of a disorder at a young age may significantly decrease the probabilities that a toddler will suffer from a disorder later in life, and shall be the foremost efficient and effective measure from a public health perspective. Prevention may require the regular consultation of a physician for a minimum of twice a year to detect any signs that reveal any mental health concerns. Similar to mandated health screenings, bills across the U.S. are being introduced to require mental health screenings for students attending public schools. Supporters of those bills hope to diagnose mental illnesses like anxiety and depression so as to stop self-harm and any harm induced on other students. Additionally, social media is becoming a resource for prevention. In 2004, the Mental Health Services Act began to fund marketing initiatives to educate the public on mental health. This California-based project is functioning to combat the negative perception with psychological state and reduce the stigma related to it. While social media can benefit psychological state, it also can cause deterioration if not managed properly. Limiting social media intake is beneficial.